Hello, children. Good morning, children. We have finished the explanation part of safety and first aid, lesson number 6. So, today we will start the reading part. Let us start reading part. Open your textbooks, page number 254. 254. Start from here, children. Accidents are caused by carelessness and are usually preventable. Most accidents can be avoided by following certain basic rules of safety. First aid. In spite of all the care which is taken to avoid accidents, they still occur. Often, patients suffering from serious injuries are saved because of the immediate help they receive before they can be taken to a hospital. This on the spot immediate medical help is called first aid. Immediate medical help is called first aid. Very often we suffer minor injuries at home which can be treated at home if we have some knowledge about first aid. If we have some knowledge about first aid. Next, page number 258. First aid for burns. A burn is an injury caused by exposure to heat or flame. In case of a burn, we should take the following first aid steps. Are you seeing here? So, in case of minor burns, put the burnt area under cold running water till the pain subsides. If dough is available in the refrigerator, then put a thick layer of dough on the affected area. It will help in cooling down the burning sensation. Apply an antiseptic lotion to avoid infection and facilitate healing. So we'll use antiseptic lotion to avoid infection and facilitate healing also. So in case of severe burns, this is in case of minor burns. In case of severe burns can cause blisters. Blisters is nothing but a raised area on the skin that contains a clear liquid and is caused by injury on the skin. So some damage on the skins are called blisters, which we should not touch or prick. On pricking blisters, they become open wounds and can catch infections easily. Severe burns should only be treated by a doctor. Should only be treated by a doctor. In case of chemical burns should be treated by a doctor only. Before the arrival of a doctor, clean the affected area with plenty of water and keep the area covered by a clean cloth. Clean cloth. Next, first aid for cuts and scratches. In case of cuts and scratches, adopt the following first aid steps. Wash the area with running water. Usually we do this. Clean the area with an antiseptic lotion. Cover the area with a cotton wool or use a damage. If the cut is deep, then you must try to stop the bleeding, which can be done by tying a bandage above the wound or make a thick pad of sterile gauze and press it over the wound. This will stop the blood supply to the cut and will help in stopping the loss of blood. This is known as tourniquet, Tourniquet, tourniquet. Next, take the person to the doctor and remember to get an anti-tetanus injection within 48 hours. That means within 2 days. An anti-tetanus injection may be required if the cut has been caused due to a rusted piece of iron such as nail or any other sharp or pointed dirty object. Yes. In case this if any these cases are there, you need to meet the doctor within the 2 days and we need to take anti-tetanus injection so that no for more days it will not be there. It will be healed within a few days. Within a few days. Now turn the page 256. First aid for nose bleed. Nose bleeding is very common during the summer season. Yes, it happens when small capillaries of the nose burst. What is meant by capillaries? Hmm? What is meant by capillaries? Minute blood vessels. In case of nosebleed, follow the first aid steps as listed here. Make the person lie flat on his back. Pinch the bridge of the nose and put eyes on it. Pour cold water on the head. Next, first aid for fractures. A crack or a break in a bone is known as fracture. In case of fracture, follow the first aid steps as listed here. Calm the person and make him comfortable. Do not let the fractured part hang loose. Put a flat object like a cardboard or a notebook under the fractured part and give support by tying a piece of cloth around it. The support is known as splint and the cloth tied around is called sling. Take the person to the doctor immediately. Okay, this is the first aid steps to be followed if any fractures are there. Sprains. While walking or exercising, many times people complain of twists around their joints. That means the muscle will be twisted in a wrong direction. This is called sprain. It can be very painful. First aid steps to be adopted for the sprains are you need to rub ice pack on the sprain to reduce the inflammation as the injured part usually swells up. If any swelling is there near to the muscles, ankles or any place, then we should rub with ice pack so that it will reduce the inflammation and injured part usually swells up. Apply a painkiller on the affected area. Do not rub. For providing support to the area, tie a bandage in the figure of 8. Are you seeing here how the boy fall off from the cycle and got hurt? After some time, his foot was swollen. That means you know how our skin will swell up if any hurt will be occurred. It was a sprain. That is called sprain. So for providing support to the area, tie a bandage like in a figure of 8. Okay. This provides maximum support and movement to the joints. Movement to the joints. See here, after an injury, first step, do not take part in an activity that can cause more pain. Moving the injured part can increase bleeding and swelling and slow down the healing process. Don't continue playing. This is the first stage. First, if you get hurt, first take rest. Take normal breathe. Next, use an ice pack to reduce the pain and swelling in the affected area. This is R, this is I, second step. Next, third step, compression. Bandage the area firmly but not too tightly, starting just below the injured area and moving up. Next, E, elevation. Keep the injured area elevated. That means you should keep in some up area. This limits blood flow and minimizes swelling. Keep legs above the level of hips by putting the leg on a chair, pillow, or stool. Use a sling for arm injuries. Next, referral. You go to a doctor. Doctor refers your reports by taking X-rays. He will check the reports. The doctor might request X-rays, ultrasounds, or CT scans to help diagnose the injury and plan the treatment accordingly. Yes. In the first 48 hours after an injury, do not use treatments such as heat or hot tubs. Also avoid moderate or intense activity and massage. So do not take your own medication. Just you should meet the doctor after some first aid steps. It is compulsory so that you will be get cured within few days. This is the steps of riser. This is called riser. R means rest, I means ice, C means compression, E means elevation, R means referral. Understood these steps to be followed for the first aid. Next, coming to the animal bites. Animal bites. Cats, dogs, rats, or few animals whose saliva may carry germs of deadly disease called rabies. Yes, very most dangerous disease this is. Hence, it is very important to treat animal bites immediately. How it will be treated? Some steps will be taken. Wash the area with soap and water thoroughly, at least 3 times to remove the saliva. To remove the saliva. So dogs will bite with mouth only, no? So what is the treatment for that? We need to take at least 14 injections near to the stomach. So that's why we should be careful with these animal bites. Okay, wash the area with soap and water thoroughly at least 3 times to remove the saliva. Next, turn the page to 58. Clean the affected area with an antiseptic lotion and cover with a clean cloth. See a doctor immediately. The doctor may give anti-rabies injections. Major symptom of rabies is hydrophobia. A person suffering from hydrophobia is afraid of water. Is afraid of water. Next, first aid for snake bite. When a snake bites someone, it injects poison to the victim's body. The poison enters the blood and spread to all parts of the body. Take the following measures in case of snake bite. First precautions is do not move the victim. This is because movement will cause the poison to spread further, to spread faster. Tie a piece of cloth or a bandage just above the bite. This would slow down the movement of the infected blood towards the heart. Take the victim to the doctor. Anti-venom injections may be necessary. Prevent poisoning. Things such as naphthalene balls, some medicines, nail paints, and detergents may contain harmful or poisonous chemicals. So, always follow these safety rules. Keep all medicines far from the reach of children. Throw away the medicines that have crossed their expiry date. Do not leave naphthalene balls around if there are small children at home. In case of any kind of poisoning, make the victim vomit. Take the victim to the doctor immediately. So this is preventing poisoning. Okay. After this, it's enough children. Next we will see the fire safety. Okay. Thank you.